Good afternoon, everyone. Thank you to Representative Brandon Reed and other lawmakers here with us today. We are here to celebrate the bipartisan passage of House Bill 75, which supports our rural and all of our hospitals across Kentucky. We have a lot of incredible leaders of these hospitals with us today. They include Mike Sherrod from TriStar Greenview Regional Hospital, Don Lloyd, who we'll hear from St. Clair Regional Medical Center, Donovan Blackburn, who we'll hear from Pikeville Medical Center, Reba Seltzer from Springview Hospital, David Stites from Bluegrass Community Hospital, Tommy Haggard from Bourbon Community Hospital, Matt Smith from Clark Regional Medical Center, David Critchlow, Senior Vice President from LifePoint Health, Sherry Craig from CHI St. Joseph Healthcare, Holly Harris Phillips, I believe, from Appalachian Regional Healthcare, and Nancy Galvani, who is the CEO from the Kentucky Hospital Association. Thank you all for joining us. Today, we are once again showing support for our hospitals and the critical care they provide to our families. First, I want to thank all of our healthcare heroes, those with us today and those working in our hospitals or other healthcare facilities across the Commonwealth. My faith teaches me that we are called to love one another as ourselves. And that's exactly what our healthcare heroes do every single day. And I know these past few years haven't been easy. We stood with our healthcare heroes as we faced a pandemic, one that came to take as many lives as it could. And our hospitals and our healthcare providers fought back. You and your teams did incredible work during the pandemic, and we are grateful. One of the first one of the first rays of hope that we had early in the pandemic was how well our hospitals did treating patients even when we did not understand and know much about the virus. Remember celebrating every single person who had made it through, the videos that came with the smiles not only on those patients, but in everybody who helped take care of them. Then we partnered together to create testing and drive-through testing that became the model for the entire country. And then we worked together to provide now every single Kentuckian with the opportunity to have a life-saving vaccine. That vaccine rollout and the months that followed were the largest logistics challenge since World War II, and we did it together. Doctors, nurses, administrators, all of our hospital employees, you saved lives even while risking your own. I still think back to the earliest of days when we did not have the PPE that was necessary to fully protect those working in COVID wings. Yet they still showed up every day to do their work, to do their best to save lives, even knowing that they could take something home that might risk not just their life, but the lives of their families. I will always be incredibly grateful for the work done, especially during those first scary months. Our healthcare heroes showed us what true courage looks like. And with that partnership and commitment to our people, we saw it continue in the wake of Western Kentucky tornadoes and Eastern Kentucky floods. And when I visited shelters, I'd see nurses write off their shifts or others coming in to volunteer, something I'm grateful for. Every Kentuckian deserves that type of care and that type of caring, whether they are in that dire circumstance after a natural disaster or in their everyday lives. Far too often when our Kentucky families sit down at their kitchen tables at night, they worry about whether they'll be able to afford to take their parents or their kids to a doctor when they're sick, or whether they will have to travel hours just to get the kind of care that they need. These are the worries I've worked to address as governor, because I believe that health care is a basic human right and that everyone should be able to access it, and access it as close to their own community as possible. No one should ever have to choose between getting the health care they need and putting food on the table. During my first week in office as governor, I worked to expand access to health care for nearly 100,000 Kentuckians by eliminating a government roadblock that was going to cause them to lose their coverage. We fought to expand Medicaid in order to ensure that our families can access both physical and mental health services that they need. And in an effort to improve maternal and child health outcomes and to increase life-saving health care services for Kentuckians, I announced that we were expanding Medicaid to cover a full 12-month postpartum period so we could have healthier new moms and healthier babies. Access to health care is especially critical when it comes to our kids. As a dad, I cannot imagine the nightmare of feeling that your child is sick and you can't get them the help that they need, that you don't know where to turn because you don't have coverage. That's why we relaunched Connect, which offers health coverage options for everyone. And the program's been expanded to include so many other services that a child getting that form of K-CHIP coverage will also qualify for. We've also worked to strengthen our healthcare systems. In the height of the pandemic, we were able to settle a decades-old lawsuit to get dollars to our hospitals that needed them at a time they needed it most. In 2021, I announced that Kentucky hospitals would receive an additional $800 million to $1 billion annually to help advance the quality care of our people and provide a stable base for hospitals, extending beyond the financial challenges of the pandemic. That same year, we announced that Kentucky hospitals meeting federal quality measures could receive up to $1.1 billion in increased payments that next year. This funding helps deliver and expand quality health care to the Commonwealth's Medicaid members and helps create healthy hospitals that can provide better services to everyone who walks through the door. Healthcare is a crucial part to our overarching success as a Commonwealth. It dramatically affects our economy in multiple ways. First, it's one of the largest jobs creator across our state. We think very often about our hospitals and our need for them, but what we don't give enough credit for is how many jobs and good-paying jobs they create. But they are also critical for getting our workforce healthier because we are creating jobs at a rate we've never seen. We are reaching levels of economic development that we have previously prayed for, and it comes with a great challenge of needing to get more of our people healthy enough to work. But we know some people need a little extra help. That's why we expanded Medicaid to cover vision, dental, and hearing, because if you are expected to head to work, you need to be able to see well enough to drive to work. And we need to make sure those barriers are not keeping people from taking these good jobs. And you, our healthcare workers, know this all too well, the nursing shortage. Those hero who shows up in the greatest time of need is a serious concern that we must address. And we are. We are working to help more qualified nurses through the pipeline faster. I also signed legislation that helps colleges and universities expand their nursing programs, good legislation that came from our General Assembly. We launched the Project Heart partnership with Galen College of Nursing and the Pikeville Medical Center to help address the nursing shortage and provide more good-paying job opportunities in Eastern Kentucky. And we're seeing healthcare services expand across the state, from Goodwill Industries of Kentucky and Norton Healthcare building the first hospital in the west end of Louisville in 150 years, to the U of L hospital being built in Bullock County, or the Appalachian Valley Autism Center in Prestonsburg. It's the PACE program that's going to help more of our seniors age at home with dignity and still get all the services that they need. So together, we have been taking some pretty bold steps, providing more access to health care than any time in my lifetime, with more of it on the way. That's why I'm so excited today to be joined by all of you to support and sign House Bill 75 into law, which adds to the good work we've been doing across our state. House Bill 75 helps rural hospitals especially meet the needs of their patients by providing nearly $1.8 billion in Medicaid funding for outpatient hospital services. When I talk about all the economic prosperity that we are seeing in Kentucky, I also talk about the responsibility to assure that we reach that success and that prosperity in every part of our Commonwealth. And if we want to bring more jobs and good-paying jobs across the Commonwealth like we are doing right now, we've got to ensure that we have solid, reliable access to health care in each and every one of those regions. We are all in the same boat, paddling in the same direction, and we only succeed together. By coming together and working with the shared purpose, we can achieve anything. Think about last year, we were #2 in economic development in the entire country. We can achieve anything. That's what Team Kentucky is all about, and today we're showing that that's possible. So let's keep working together, building each other up, making sure that this coming prosperity is something that everyone has an opportunity to be a part of, and that we get everybody healthy enough and keep them healthy enough to enjoy the good days that are coming. Now, I'd like to invite Representative Brandon Reed from Hodgenville to say a few words. He shepherded this bill through both chambers. Let's give him a big round of applause for getting it done.
Thank you, Governor. HB 75 is aimed at improving access to quality health care for each and every Kentuckian, as well as serving as a lifeline to rural hospitals serving communities throughout our Commonwealth. With HB 75 now granting access to hospitals to be reimbursed for outpatient services, hospitals will be able to harness federal resources while using no state funds. This measure simply builds on legislation we approved in 2019 with Representative Bam Carney and 2021 with HB 183. I thank the Kentucky Hospital Association for once again trusting me with their legislation, and my primary co-sponsor, Dr. Danny Bentley, for his help and guidance through this process. Thank you to the many co-sponsors from both sides of the aisle, and thank you to our governor for your approval. Thank you all.
Thank you. I'd be remiss if I didn't also thank Representative Bentley for his work when it comes to insulin. That's something that everybody who needs it should have, and no one should ever be rationing it for any reason. Next, we'll hear from the Kentucky Hospital Association Board Chair Mike Sherrod, CEO of TriStar Greenview Hospital in Bowling Green. I'll clap for you.
Thank you all very much. Again, I want to thank the governor. I want to thank Representative Reed and Representative Bentley. We couldn't have done that. Hundreds of bills that get started. It's hard to get those started and have leaders that are going to finish that. And these gentlemen did that. And thank all the co-sponsors, to the Senator Stivers, his group, Representative Osborne, his group. It was a great teamwork. And again, I thank the governor for his support. You know, the impact that we have today is so important to all the stress in the hospitals. I was at a dinner last night with doctors, and we were just talking about this time last year, we had no surgeries. And they were talking about, hey, that was the right decision then, and have that leadership to say that, you know, how do we navigate this? And now we come through it, and now here we are staring like, how do we keep the investment? How do we keep on investing in our people? And it's interesting to hear that dialogue, and today it's something to celebrate, that we're going to be able to have funds to continue to make Kentucky's healthier, to have those investments that we need. We're growing. You talk about the economic impact with the second largest growth in the country, but we got to have the infrastructure to deliver care. And this really does allow that, and we really appreciate everyone's support on this as we take this journey forward. So thank you very much, and Governor, thank you, and Representative Reed, thank you very much for what you've done. Thank you, sir.
All right, next up we have Don Lloyd, President and CEO of St. Clair Healthcare in Moorhead, who serves as chair of the KHA Legislative Committee.
Ladies and gentlemen, I'm honored to be here and to thank the governor for his consistent commitment to supporting hospitals and health systems all across the Commonwealth. Since the inception of this administration, the governor has taken decisive and courageous action to support our state's hospitals. The governor's actions today is yet another demonstration of his support and commitment to strengthening the financial stability of hospitals and health systems throughout the Commonwealth, but especially for rural hospitals with the expansion of the HRIP program authorized in this bill. More importantly, by signing this legislation, the expanded funding provided by HB 75 allows our institutions to improve access and to expand care in the communities that we serve. We thank the governor for directing his administration to work on this legislation and for the work with the legislature to formulate the passage of HB 75. We also owe a debt of gratitude to Secretary Freelander and to his entire team for supporting and providing expertise and guidance with this legislation. We thank the entire General Assembly, but especially this bill's sponsors, Representative Reed, Representative Bentley, But the entire General Assembly unanimously approved this legislation in the House and nearly unanimous in the Senate. And that would not have been possible without the leadership of our General Assembly. The leadership of the Senate, President Robert Stivers, and the leadership of the House, Speaker Osborne, Speaker Pro Tem Meade, Majority Leader Rudy, Minority Leader Graham, they have all collectively and individually supported this legislation for the benefit of all Kentuckians. Today is a proud moment for this Commonwealth and in our industry. Kentucky has become the envy of states all across this country because of our state's leadership. Governor Beshear, our legislative leaders, Secretary Freelander, our leadership has placed patience before politics, and for that, we all owe each of you our sincere gratitude, our admiration, and our respect. Thank you, Governor Beshear.
I should have recognized Secretary Friedlander, and you're welcome to join us up here. We also have from Commissioner of Medicaid, Lisa Lee. John, come on up with us. It's all right. All right, and finally, we welcome Donovan Blackburn, Chief Executive Officer at Pikeville Medical Center.
First, Governor, I want to thank you for the honor and privilege of being part of today's very important signing, along with thanking him for all that he has done and his administration has done in the name of healthcare. So thank you, sir. Because it is very important to understand how significant House Bill 75 is to all Kentuckians, I would like to start today by introducing a little about my hospital, Pikeville Medical Center. We're the single largest regional hospital in our part of the state with 348 licensed beds, with an 11-story specialty clinic and a higher level of care to serve the region and the patients that we serve. We manage nearly 2 million square feet out of 49 different buildings in Pike, Floyd, and Letcher County. We have a service area of over 450,000 residents, and last year we saw 501,728 patient encounters. We're the single largest employer in our region with over 3,000 employees coming from 33 different counties in Kentucky. In 22, we provided $234 million in wages, representing nearly 30% of Pike County's total wages. As a matter of fact, Forbes ranked us as one of the best hospitals in America, best of state employers. We're a transfer hospital accepting in 22 patients from 48 hospitals within our region. We have the only level 2 trauma center. We operate a level 2 advanced NICU center with an OB ward that delivered almost 1,000 new Kentuckians last year. We are home to 9 different excellent centers. Unfortunately, the region we serve also leads the nation in cancer rate, heart and vascular disease, pulmonary disease, and obesity. We serve the sickest of the sick and some of the most financially challenged citizens in the state and in the nation. Like my counterpart and friend with ARH, our payer mix is 77% Medicaid and Medicare, being one of the highest percentage rates in the nation. Because we are remote, we typically pay a higher operational rate, experience longer patient stays due to treating sicker patients, and have less commercial insurance, resulting in lower reimbursement per patient and with a higher cost due to the required resource burn. So our operational costs are higher, our payments are lower, and our margins oftentimes are even lower. To compound our challenges over the past 3 years when dealing with COVID, we have seen our expenses raised by nearly 30% while still being 77% dependent upon Medicaid and Medicare, whose rates have not nearly increased enough to offset the general wage inflation, leading to our current financial crisis for our hospitals. Now imagine what would happen to the people we serve in our region if we were forced to cut services, or God forbid, even close down services due to these financial challenges. Thanks to the Governor, Secretary Freelander, KHA's leadership, and our amazing legislators, and for CMS for providing inpatient ATRIP for last year. This offered much needed financial relief, but still was not nearly enough for almost every hospital to overcome our financial burdens. No doubt without it, several hospitals more than likely would have indeed closed. With current financial pressures and challenges in hospitals across the state, including mine, without additional financial assistance, we fear the worst. Due to these unprecedented and ongoing circumstances, last year my hospital lost $24 million. With this year, with our financial condition, we project another $14 million loss. With staffing shortages projected to continue, we will no doubt double our wage rates and be more dependent upon our agency cost, which will cost us millions. This was simply not a sustainable model. Without today's actions, most hospitals in our state would have no choice but to find ways to start cutting costs. For a hospital like mine, that can mean cutting jobs, downgrading services, which will lead to delay of care, more illnesses, and worse diseases. Through and by the adoption of House Bill 75 into law, this is truly a life-saving action. This will not only save hospital jobs and services, but will also imagine what would happen to businesses, especially in rural communities that depend on hospitals' local purchases and wages to support their businesses. This significant piece of legislation in a time of our state's greatest need in order to preserve the state and quality of care for all of Kentuckians. As an administrator, I know I speak for all Kentucky hospitals by thanking several individuals and groups that have made today possible. First, for the sponsor of House Bill 75, Representative Reed and Representative Bentley, thank you. And for the multiple co-sponsors of the bill, and for understanding the urgency and our need. Next, Secretary Freelander, and for the Cabinet for working with CMS on behalf of our state, citizens, and hospital. The Secretary has met with me repetitively to discuss our current financial concerns. Also, Nancy Galvani, with KHA, for making this our top priority, for working directly with our legislators, and for educating those in need to help better understand the crisis and our immediate need. Many thanks to Speaker Osborne and the 95 representatives and 33 senators who worked in a bipartisan way to make this a priority for passage. Senator Stivers, personally, for accepting a joint meeting between myself and my counterpart, Holly Phillips at ARH, and for turning a 30-minute meeting to over an hour and a half, and for listening to our concerns and pledging his support for this initiative. And last but not least, Governor Andy Beshear, who has made many trips to Pikeville Medical Center. And I am glad to come this way for a change. Thank you.
Welcome.
And for proving time and time again that he is a champion for better health care for all of Kentuckians. I've heard this governor say many times, including today, that he believes that health care is a basic human right. Today is yet another shining example of his belief, his leadership, and his unwavering support for a healthy Kentucky through and by the signing of this bill into law. Though this bill is necessary for HRIP, there has been months and months of work by this administration, work with CMS to provide our outpatient HRIP, and now this new inpatient advanced payment opportunity that will save jobs, hospitals, and preserve care for those we serve throughout our Commonwealth. By signing this bill into law, Governor, you have once again shown your priorities are in supporting business, quality of life, and yes, life itself. So again, thanks to you and to all those that have made today possible and a reality. Again, thank you for allowing me to take part of this historic signing of House Bill 75 into law. Thank you and God bless.
All right, now we are going to sign this bill, open up $1 billion plus in additional dollars coming to our hospitals, which means we are going to ensure and continue to work on expanding access to high-quality health care right here in Kentucky. So we would invite not just who's up here, but everyone from our hospitals that's come in today to be in support to join us for the signing.